Hello, my name is Dr. Brad Revering. I'm a dentist in Flower Mound, Texas. Our office does a variety of restorative procedures, and one of those procedures is placing laminate veneers. This presentation will go through a clinical case that we just completed recently, and I'll just kind of go through some of the tips and tricks and things we've learned along the way. So here we have with the first slide is a gentleman who comes in. Really doesn't have that bad of teeth as far as arrangement. There is some crowding you can see on the bottom and the tops. All he really wanted was to just make things look more uniform. We discussed the option of doing bonding, but with the bonding being fragile and being prone to fracturing, he wanted something that was more sturdy, so we suggested going with porcelain laminates. Here you can see we've went ahead and prepped the front 4 upper teeth, and what I like doing these days is minimal preps. You can see that we have not really even really broken the contact in some of these preps or in between some of these teeth, and we try to maintain as much as we can in the enamel. Here's the slide showing the before, pre-op, and then how he looks post-op. Looking from the occlusal, you'll notice that we try to get any enamel that's too far facial. We're going to reduce those areas more heavily just to kind of get the arch form back into more of a proper shape and have it be more uniform. This next slide just shows examples of other types of preps. These were not preps that we've done in our office. These were just simply gotten from the internet. And these kinds of preps, at least in my opinion, are just too aggressive. Many years ago, back in the early 2000s, these kinds of preps were being promoted because of the advent of dentin bonding agents. But what I've learned over the years is bonding agents, whether they say they're dentin bonding agents or not, just don't really bond that well to dentin, but they bond really well to enamel. And in my opinion, looking at some of these preps in this slide, if it's going to be that kind of prep where you go in between the teeth, heavily into the dentin, in my opinion, I just go ahead and wrap the entire lingual, carry the prep all the way around, and just make it a crown. I think you're going to find that the restorations are going to hold up better. At least that's what I found in my office. Now the lab that I'm using for this case, when they return the veneers to me, they're already going to have them etched with hydrofluoric acid, and they're going to apply the silane coupling agent as well. When you open up the case, you can see this is what they look like. I've got the 4 veneers up at the top of the screen, and I have the 2 on the left are flipped over so you can see the internal surface, and the 2 on the right are the facial surfaces. The picture down below is a close-up view of the internal surface of what the veneer looks like fresh from the lab that has properly etched and silanated the internal surface of the veneer. I show this slide because I've had other labs turn in cases to me where there is a chalky white residue on the inner surface, and that's something that you definitely do not want to have, because I've had clinical failures years ago trying to make something like that work. If you do run into that, you need to discuss it with your lab on what steps they're actually going through, and if you need to remedy it, go ahead and fix it in your own lab by just cleaning that off. Go ahead and use your hydrofluoric acid, edge it for about 90 seconds, rinse it off thoroughly, and then apply silane coupling agent. And in my opinion, I like to use a 2-part silane mixing technique where it's a part A, part B, you mix the 2 together, you then apply that to the internal surface, and that's when I think you get the best, most active, freshest form of silane, as opposed to the bottles that already have it pre-mixed. Okay, so for this patient, after we prepped the teeth, when he left, we made him some temporaries just based upon the shape of his teeth before we actually did the preps. And so we had very thin bis acrylic temporaries placed on those teeth, and when he returned, you can see in this photograph that they've already chipped and broken apart. He wasn't in any sensitivity, and you can tell from the preps there were minimal prep, so he didn't really have any problems with that at all, and aesthetically it didn't matter to him. Okay, so we have to take the veneers off, and we'll do that by flaking off as much as we can with a scaler, then take a diamond burr and remove the remaining part that was etched into place, and then go between the teeth with a perforated strip. Upon completion of that, we will then take pumice. Um, I like to use a chlorhexidine-based pumice and clean up all the teeth. Just use a regular Profi cup. Use it on the teeth that are prepped, and use it on the adjacent teeth as well. And with the pumice still on the teeth, go ahead and take some floss to clean it approximately. Once everything is off, now we're going to go ahead and try in the veneers. And I try them in dry initially just to make sure that they fit, and I try each one without any interference from the neighboring teeth. I'll then try them in side by side, and then I'll try in all of them just to make sure there's no interference interproximally. Now comes the time for us to actually try them in, and I'm going to use that actual try-in paste that matches up with the composite shade that we're going to use. In this case, we're going to be using a translucent color. There's some clinicians I know that just use water, but I like to use the actual product that I'm going to be working with when the actual cementation. So when I put them in, I will put them in one at a time, and then I'll put them in collectively, and again, just making sure they don't run into each other and that there's no binding. And I'll check lingually to make sure that they're seated all the way. And once they're in, I'll put in this case, all 4 of them in. And at this point, the patient will take a look. They're going to make sure that they like the appearance of them. They're going to sign off on them basically knowing that that's the color, that's the shape, that's the length, that's the size, surface texture. It's their chance right now to either say yes or no. And I'd say 99% of our patients say yes, they love it. Okay, now comes the time of getting these veneers ready to be seated. If you take off the try-in paste, the try-in gel, and we've even tried it with just rinsing it off with air water, putting it in ultrasonic for about 4 or 5 minutes. When we take it out, you'll see that the internal surface still doesn't look quite clean. It doesn't look like when we first received the veneer from the lab. There seems to be some kind of slimy layer that's on there. And the way that we remove that slimy layer in our office is by using just denatured alcohol. It just comes in a big 1-gallon jug, and you use that with micro brushes to clean the internal surface. So after I've cleaned it with an internal surface, or clean the internal surface with this with these alcohol brushes, this is what the internal surface looks like. It should look just like when you first received it. It should look like it's frosty and clean. And look at the slide here. You can see the difference before and after. Also, when you're using the brushes, I like to use 1 brush per restoration because what happens over time, that gel will get inside of the solvent, and you just want to make sure it's a clean mix. And at the very end, I'll just take in this case, all 4 of them, and I'll just dump them into a dapping dish filled with the alcohol. Just as a side note, when you are washing these restorations off, it's best to have some kind of protective feature below it. In this case, you'll see just a green mixing bowl. If when I'm spraying that with water and air, for some reason I lose control of that veneer and I drop it, I'd much rather it drop into something like that where it's not going to break, instead of it landing on the floor inside of a metal sink or on a countertop. So just keep in mind you should have some kind of safety net underneath these veneers or any kind of restoration when you're applying water and air. Okay, so here are all 4 of the restorations. You can see I'm having on a blue background. You can see that one veneer, that one central, is kind of thin. You can see the actual blue shining through. But that's the nice thing with these types of veneers, is they can be made of that thickness, make them that thin, and they will still hold up over time. Okay, so now the veneers are ready to go. Now let's go to the mouth and get ready to get the enamel prepped. Here you'll see that we've got the etch is going on, and when we put the etch on, we're going to make sure that it gets completely all over the facial surface, interproximally. I've got the clear matrices in there to block the canines from getting etch on them. I'll even go around to the lingual side and apply etch there as well. Again, looking at the restorations now, I've got them, I'm sorry, not the restorations, but the teeth. I have those etched, I have them rinsed, and now this is what you should see. It should be a nice frosty appearance. The only things that aren't going to look frosty or look etched is going to be the dentin areas, which I have outlined on this slide. And so when I take a look at a veneer prep, this is what I keep in mind, is that the veneer itself ideally should be 100% in enamel. But if it's going to be in dentin, I want really the dentin to only comprise at most 15 or 20% of the overall surface area that I'm going to be applying the veneer to. Again, it goes back to what I said originally. If you're going to have more dentin than that involved in this prep, it's probably just best to go ahead and put a crown on it. It's just going to hold up better over the long run. We're going to take the veneers and place a dentin bonding agent. We like to use Adper in our office. It's a 3M SP product. Going back to the teeth, I will then apply Microprime by Danville Engineering. It is just a glutaraldehyde-based desensitizer. It also helps clean off the preps and helps reduce the bacterial count on them. That is then dried off, attaining that frosty appearance again, and then we're going to coat the surface with the Adper, the bonding agent. And we apply several coats to that. I'll apply it, I'll thin it, I'll apply it again. And when I'm thinning it, of course, making sure there's no water coming through, even just the tiniest little droplet of water, you can't have that coming through. It has to be 100% air. I'm going to be blowing that bonding agent gingerly. I want it to completely flow over this gum tissue. We're lucky in this case that this patient didn't have any inflammation of the gums prior to seeding. If you do have a patient that has a lot of bleeding, you may have to reappoint them. You may have to put in some kind of astringent agent, although I have concerns about that chemically reacting with our bonding agent. Use a laser, pack cord, but basically you have to attain a very dry field when you're going to be applying these restorations. Okay, now it's time to take the veneer and fill them up with the actual bonding agent. So again, we're using the Accolade product. We just seem to like this one. It just seems to handle quite well. The viscosity works out great with veneers. When I push one into place, the excess cement oozes out. You see about how much comes out. I'm going to place all 4 of them in. And at this point, I have not cured anything. I've not even cured the bonding agent that I placed on the teeth themselves. I'm just going to wait and cure it all at the end. I don't want to take a chance of some bonding agent wicking in between interproximally 2 teeth and blocking the restorations from going down 100%. Now when it comes time to cure, I'm going to cure one at a time, but I'm only going to tack it for like a half a second. And in this case, you'll see I'm holding tooth number 9. I'm applying finger pressure at the gingival part, and I'm also taking an instrument and I'm pushing apically to make sure that veneer is completely seated. My assistant is then going to come around from the distal and cure that side. And the slide, or this slide is showing the second tooth I've cured. I've already cured the lateral. Now I'm moving from the patient's left to the patient's right, and I'm going to just cure the distal surface of that veneer. When that's done doing its 1 second tack cure, I'm now going to move over to the other central, tooth number 8, and I too will apply the same finger pressure and instrument pressure, and apply again just a little spot cure on the distal. I'm sorry, in this case it'll be the mesial, tooth number 8, before I move on to tooth number 7. It just allows me some working maneuverability when trying to place the subsequent veneers. Okay, and then at the end I'm going to just go through and just tack them. I'm going to go on the lingual and just tack that as well. When I say tack, we're talking like a half a second cure, just enough so that I can go in with an instrument like this and peel away the cement before it becomes extremely hard. It's also at this point it's strong enough to go in with floss to clean out interproximally. It makes it very easy at this point when it's in its semi-set stage. And if in case you don't, or you can't get floss in between the teeth, you can take a serrated ribbon and gently open up the contact. Okay, now that we have a majority of the cement cleaned up, we have the ability to floss between the teeth. We'll go ahead now and cure all the restorations. And I will do kind of a waving around motion as I cure. I don't want to just camp out in one area with the curing light. One, because of too much heat, but second, I don't want to have the polymerization to be skewed in that area, in just one area of that veneer. I want it evenly dispersed across the veneer so that the resin sets uniformly. Okay, once it's all set, we'll remove any other extra cement, and then we're going to check the bite. If it's just resin that's excess that's on the enamel, I will use a a carbide finishing burr, but if it's actual porcelain I need to adjust, then I'm going to use a fine grit diamond burr. And here's the patient in smiling. Here we are retracted. And this is the day we seated it. There's probably still some bonding resin that might be on the gums or be on the restorations themselves. So it'd be nice to have a follow-up to this video showing the actual, a follow-up visit, several weeks later. But this is just showing immediately after we put them in. And here's a close-up. Again, we just did the front 4 teeth. Here's the before and after. Again, not a dramatic change, but it was enough to satisfy what he was wanting. And here's the retracted view. And that's our presentation. If you have any questions, you can feel free to email me through our website at www.crosstimbersdental.com. And thank you for watching this presentation.